everybody. I hope you're all well. It's a welcome and it's so good to see you back here again. A little bit cloudy day, but it's okay. It's still a beautiful day. Today we'll be talking about breastfeeding, and we have amazing lactation consultant for live. But first, let me introduce myself. I have been women's health coach for past 8 years, and I have just added nutrition to my, thank you. Welcome. Shona is here. And and I have added nutrition counseling to my, here we go. I got a bit startled there. So I have just added nutrition to my nutrition counseling, to my coaching. Hi, Shona, welcome. Thank you for coming here.
It's good to be here.
Yes, thank you so much. I've wanting to bring you on live for so long, and today you are here, and it's a pleasure to have you here. So and I was just introducing myself. So, and yes, of course, I'm the host and the founder of this platform, and we have Shona here today, who is a certified lactation consultant and breastfeeding counselor, right? And let's know more about Shona. So I'm going to read your bio, okay? Or would you like to introduce yourself?
No, you go ahead, Ange.
Okay. Shona is an international board certified lactation consultant. And if I don't say it right, you have to correct me, okay? So you have to bring out your Irish. Like you said
Scottish,
earlier.
remember? Scottish.
Oh, Scottish. I'm so sorry. Oh, my goodness. Yes. I'm in trouble already. And and a volunteer breastfeeding counselor with the Australian Breastfeeding Association. Originally from Scotland, Shona moved to Australia in 1997, and both her children were born here. She has been supporting women and families with breastfeeding for 19 years. That's a long time, Shona. Well done. Amazing. As a volunteer breastfeeding counselor, she is one of a team of hundreds of trained volunteers in ABA. These volunteers provide breastfeeding support and information by taking calls on the National Breastfeeding Helpline, answering questions on, can I say ABAS or ABAS?
ABA, yeah.
ABA, live chat service, and through in-person and online group get-togethers from mum and parents. As an IBCLC, Shona runs her own private practice offering in clinic at home appointments across the Gold Coast, northern New South Wales and into the hinterland. She also gives her time freely to local parents support groups whose participants are seeking information and support about feeding, and particularly enjoys working with young parents and parents-to-be. That is amazing, Shona, and you have done for 19 years, and that is incredible.
Yeah.
Thank you, everyone, for being here, and welcome. And so before we start, Shona, so is there, I read everything right about you.
Oh dear.
Yeah. And so before we start the conversation here, I just wanted to say that this live is all about to bring awareness and provide you with the information, not a particular advice for you. So if you need support, please stay for our Q&A session to the end, or you can contact Shona, right?
Yep.
So would you like to add anything in there, Shona?
No, I don't think so. I think if there's anyone out there who's struggling with breastfeeding or any aspect of that, reaching out for help is really important. The National Breastfeeding Helpline is there 24 hours a day, 7 days a week. And that's a good place to start.
Yes.
Or reach out to somebody like me, a local lactation consultant. And as a lactation consultant, we don't just deal with feeding problems. You know, we look at where mum is at, her mental health, where her family is at, how sleeping is going for baby and mum. Like, we can deal with all of those things together. So yeah, if you're struggling, then reach out for some help.
Yes. So when we say breastfeeding, it's just not the breastfeeding, but the whole situation.
Everything, that's right.
around.
Everything that goes with that.
Yes. Yes. Fantastic. So we will start with, so this week we are celebrating World Breastfeeding Week, right? So what is it?
Oh, okay.
Can you elaborate on that, please?
Sure. So World Breastfeeding Week is an event that's organised every year by what they call the World Alliance for Breastfeeding Action. So that's a global network where they aim to protect and promote and sort of support breastfeeding across the world. So World Breastfeeding Week started in 1992.
Wow.
And every year there's a different theme, okay, to raise awareness about breastfeeding.
Yes.
So that's across the world. And this year's theme is all about closing the gap, and it's breastfeeding support for all. Because we know that at a worldwide level, breastfeeding support is not equally available to everyone who needs it. And that's not right, you know. So breastfeeding support is important because breastfeeding provides lifelong health benefits to a baby and to the mother. And women who don't receive breastfeeding support in the first week are less likely to breastfeed or will give up sooner. Okay, so we also know that breastfeeding can act as what they call an equalizer across the world. And what that means is, because breastfeeding improves the health of a baby and the mother, and it's important for the bond within the family between the mother and the baby, it's well studied that not only does it improve health, but that has a knock-on effect for their whole life in terms of sort of helping their chances of getting a good education, getting work, and having a better standard of living. So if you can help women to breastfeed, you actually help everybody in that family. Okay.
Yes.
Yeah.
Well, because so because where I come from in Nepal, I never ever knew that you know you could not, if you cannot breastfeed. You know what I mean? Because I didn't know any different.
Correct.
And when I moved to Western side, and then I saw that women has option whether they want to breastfeed or not breastfeed, or some people might not be able to breastfeed, or you know, all those things. And instead of misjudging the person who is not breastfeeding, because where I come from is like, it's not even in our thought that you would never go through that, right?
Correct.
So understanding that, and what you do is so important. And for me in past, I would be like, Shona, what are you doing? Do you know what I mean?
Right, because Nepal and countries like it, breastfeeding is what you do. It's what everybody does. Yes. And therefore, everyone in that society is immersed in breastfeeding. So women see other women breastfeeding. You see them breastfeeding when you're growing up as a child. You know what it looks like. You know possibly what it's going to be like for you. And you've got lots of people around you to help you. So when you struggle...
we live in a joint family. So we have grandma, we have, mother-in-law, sister-in-law, we all supporting how to, and all those things, the care around the postnatal care and during pregnancy is incredible, because we live in that joint family, right? So that's right. Why I never understood to start with that how can you have problem breastfeeding.
Correct.
And when I start struggling, I didn't know, I just forced myself through the pain, or I didn't know all those things that you can have the support. But yes, now it's too late for me, but for other people, it will be a big help for the people that who are going through that right now, right?
That's right.
So,
that's right.
Yes. Yeah.
Because
so,
what I was going to say was, in Australia and in Western culture, where bottle feeding is part of what you see in society. When you
Yes.
want to breastfeed, it can be really hard if you've never seen someone else breastfeed. But also if you live in a society where breastfeeding isn't really common, it means that sometimes even healthcare professionals don't know much about breastfeeding, and your mum might not know much about breastfeeding, and your neighbour doesn't know much about breastfeeding. So then you're struggling to find people that can help you. Yeah. And that's what we know, is if we don't get help in the very first few days and weeks with breastfeeding, it can be too hard to keep going.
Yes.
You know?
Yes, and it's easy when you don't have that support system, then it's so it is more likely to feel more exhausted, and and when you don't feel like there is support, and you're more likely to give up in it, right?
That's right. That's exactly right. Yeah, yeah. And I get why World Breastfeeding Week can be really hard for many women, because I had two very different feeding journeys with my children, and it is really hard to navigate your way through World Breastfeeding Week when you didn't meet your own breastfeeding goals. So that was something else I wanted to say today, that I get that, I understand that feeling. And if you want to have a chat, if there's anyone on here who wants to have a chat about their feelings around how their feeding situation is going or went, then just get in touch. I'm happy to have a chat with you.
That's fantastic. Thank you, Shona. We really appreciate your time, because we know you don't have time for rubbish, right? So so what's happening for World Breastfeeding Week here in Australia?
Right. Okay, so like you said, part of what I do in my life is I'm a volunteer breastfeeding counsellor with the Australian Breastfeeding Association. So ABA is like the main organisation in Australia that promotes and protects breastfeeding. And so they've taken on this theme of breastfeeding support for all. And particularly they're focusing on our people who are culturally and linguistically diverse, which includes our Aboriginal and Torres Strait Islander people, because we know from the research that mums in these communities face barriers to getting help because there are language differences, they have a lack of social support, they maybe don't have families here, there's issues accessing healthcare, and then there's lack of follow-up care. So ABA has been really focusing on that this week, which is good to see. ABA has lots of resources in lots of different languages, but they're always meeting the demand of what's in the community. So we don't cover all languages yet, but every time we get more requests for resources in different languages, then we try to make that happen. Okay, so yeah.
Yes, because Australia is such a multicultural country.
That's right.
So,
that's right. Exactly. So many of us come from where?
Yes, because when I first came here, because I've been, Europe, America, everywhere, but when I first came here, I was like, wow, they do accept lots of people here. I was happy at the same time. I might have better opportunity here. Felt that way, but sorry, I got a text and I got distracted what I was saying. Oh my goodness.
You're a busy lady.
Yeah, a little bit. So so we were talking about what the ABBA is supporting, how they're supporting in Australia in our breastfeeding week, right? So how have you been celebrating this week?
Coming on here with you.
One of them is one of it. Thank you.
Yeah. I've just been continuing to do the work that I love to do. Like, the work that I love to do is supporting local families, women who want to breastfeed. And I think that's what I've been getting on with. I also ran a workshop on the weekend with ABA. It's an education seminar series that they run, educating healthcare professionals, because we know that that's where, like, many healthcare professionals want to know more about breastfeeding. They don't get a lot of training about breastfeeding in their medical training. And so we have lots of healthcare professionals signing up for that. And I help to run some of those workshops. So that always feels like something really useful to do, because those people are working with mums every single day, and they can make a difference if they have a little bit of knowledge.
So you're not only helping the public, but the practitioners as well, to make them understand what is, because it would be such a wonderful thing to learn if they can provide, like the support around breastfeeding, while, for example, if it is a GP and people like that, you know, it
That's
will be, yes, it's, yeah. And talking on that side, and I kept, yeah, I wanted to ask that. I heard that you and Dr. Francis is working together.
right.
So tell us
Oh,
a little bit about that.
yes, that's right. So myself and Dr. Francis Knight, we're running a new mum and baby clinic up at Hope Island Medical Centre every week. And it's for all mums and babies. So regardless of how you're feeding your baby, and it's not just about feeding, it's about everything else around supporting mums, especially in those first few weeks and months after you have a new baby. So it's things like feeding and baby's growth, and baby's sleep, and mum's health, and mum's mental health, and anything else related to being a parent. So I guess how Francis says is, it's like you get two brains looking at the problem. Okay, so you get to see
Yes,
both of us in one spot at the same time. And it means that you don't have to go to two different places for checkups and things like that.
yes,
So yeah, we're every Thursday at Hope Island Medical Centre, and you can get in touch with me, or you can get in touch with Francis if you want to
yes.
book an
So,
appointment. Yeah.
yes. So you're going to be there all day and at
Yeah,
that clinic?
we'll be
Yeah.
there as long as we're needed. Yeah. So yes, all day.
Fantastic. Okay. Hopefully, slowly, you know, you will increase the day apart from the, you know, more days. So,
Oh well.
yes,
Yeah, hopefully.
yes,
Yeah.
that's fantastic. Congratulations
Mm,
on that. You know,
thank you.
I was like, oh, you know, two amazing people coming together. That's amazing.
Mm,
So if
it's
Yes, so if anyone has any questions, please pop it in the comment section. So while we're waiting for the questions, we're going to ask Shona where people can find you. What's the best way to connect with you?
right. So I think on this platform is quite a good way to connect with me, because then you can see the sorts of services that I provide, and there's also a link to my website. So I do home visits, and I also have two different clinic days, a clinic day on a Tuesday at Ashmore with the lovely Dr. Riarn and her clinic, and
Yes.
then a clinic day on Thursday with Dr. Francis at Hope Island. And I also do telehealth and phone consultations. So for example, sometimes mums also come to see me for weaning when they want to stop breastfeeding. And
Oh,
those sorts
okay.
of, yeah,
Interesting.
because sometimes we don't
Not
know.
just the start, but then weaning is challenging too, right?
That's right. And nothing gives me more joy than seeing a mum in the beginning when they're just learning to breastfeed and they're struggling and they don't know if they can keep going. And
Yes.
then like a year later, they come back and go, now I need to stop. I don't know how to stop.
I can't keep doing this. Yes.
So we can do weaning chats and things like that by telehealth, by video or by phone, and that can just be a really good way to just talk through where you're at and what you want to do. And
Yes.
I've got experience of weaning toddlers, so I can help.
Yes, no, because I always thought, you know, like when we talk about breastfeeding, it's all about how to breastfeed, you know, not about the winning winning the baby.
And that's the other thing that's good to remember, is that yes, a lot of the mums who come to see me, it's because they're struggling in the first few weeks or few months. But then there are other key times when mums will come to see me and I can really help. So when you're going back to work and you want to know what your options are for,
Yes.
you know, feeding or not feeding or giving bottles or whatever you want to do when you go back to work. So that could be something. Sometimes feeding's working okay, but it's happening too often. And we want to set some boundaries on it.
Yes.
With an older baby, like they're feeding all the time, like little things like that. You can book an appointment with me. I can chat you through all of that. And then life can be a bit easier, you know. So
Yes.
breastfeeding is really intense in the beginning and it takes a lot of work. But then it sort of evolves and changes. But sometimes we're the ones, like a mum might feel like I'm ready to stop and my baby isn't. But we can
Yes.
talk through that and figure out what might work for both of you. So yeah, I do the whole thing from beginning to weaning. Yeah.
Yes. Because for me it was very confusing because I was breastfed till I was 5 years old, right? So,
Mm-hmm. Yeah. Yeah.
and
Which
I
is
think maybe
which
later
at a
on, yes,
worldwide level, not unusual. In Western culture, people go, pardon, you know,
yes,
like yeah. So we've got to
because
realise that, yeah,
yeah,
that's a
because we
normal
don't
thing.
have the formula option or the other option, right?
Mm,
And that
mm,
is all we had to,
mm, mm.
and what you know the mothers can do back home.
Yeah.
And so
Mm-hmm.
when I came here, the first one was 2 years breastfed, and everyone was like, "What?
Mm.
you breastfed for 2 years? I was
Mm-hmm.
like, oh, you know, I myself was for 5 years. I drank off my
Yeah,
mom for 5 years. But
that's right.
it is, yes, it's very
And it is,
interesting to,
that's right. So we're very affected by culture. Like what you experienced is actually normal. Okay. In Western culture, not normal, not common in our culture, but the Western culture is the weird one.
yeah,
Okay. So when they look when yeah, no, it's true. It's true. So the World Health Organization recommends that we should exclusively breastfeed for this first 6 months, so not give our babies anything else, and then continue breastfeeding to 2 years and beyond. 2 years and beyond, because that's sort of where we should be breastfeeding. It's not where we always, how long we choose to breastfeed for. But there are all sorts of barriers in Western culture to continuing on. Okay, now, and I would say as well, Ange, there are plenty of women who are breastfeeding older children in Australia, but they probably don't talk about it.
no, no, because it's not something that you openly talk about, right?
No,
Yes,
that's right. That's
because
exactly
we
right.
think
Yeah,
it's weird
yeah. Mm.
in here. So yeah, if any one of you breastfeeding, don't be ashamed.
So,
Back home, we feed the kids as long as they want, and yeah, and coming towards end, it might be just for comfort, right? But then,
absolutely.
but that is yes, yes. So
Mm-hmm.
yeah, but you are here to help us to how to win the baby, like
That's right.
calm and gently for both mom and kid, right?
Right. That's exactly right. There are lots of
Fantastic.
gentle ways that you can change it. Yeah. Mm.
Yes. Fantastic. I think we have covered everything we wanted to talk. And if anything else you would like to add or the resources you would like to talk about, is there anything you would like to say?
I've always bit of self-promotion, hang out on my page, see the
Promotion?
sorts of, why not?
Why
Hang out on
not,
my
right? Yeah.
page. Yeah. Hang out on my page, see the sorts of things I'm talking about. Message me if you're looking for other information. What you'll always get on my page is evidence-based information, because there's an awful lot of inaccurate information about breastfeeding and baby sleep and things out there. Remember, anyone can post anything on socials or on the internet. So yeah, hang out on my page, look at the sorts of things I'm talking about, and get in touch if you need any more info. Yeah.
Yes, awesome, fantastic. If yes, and I wanted to add before we go that we have amazing women's health event coming in September, and if when you read our details and if it resonates to you, we would love to see you in person, and everyone is welcome. And like hopefully you'll be able to make it as well, Shona. And yes, thank you everyone for being here. Shona, thank you so much for your time and your expertise. We truly value you and everything you do. Thank you
Thanks.
for being here.
That's okay.
Yes, you
Have a
have a
great day.
great day, everybody. Yes, I will see you when I see you,
Yeah,
Shona. Thank you so
no
much.
problem. Okay, see you.
Thank
Bye.
you. Bye. Have a great day. Bye.